So as a general surgeon, we kind of intervene multiple facets. Sometimes it's just kind of generalized pain, and it's our job to kind of figure it out and see if there's something that we can do to fix it. Or we come kind of the more emergent situations where you're having an acute episode of bad pain, and that's where usually the general surgeon gets involved. The good part of our job is that we usually can do something to take away that pain. So that's what's really satisfying to me about general surgery. One thing where I didn't think I kind of fit with the typical mold of being a surgeon is that I want to be very approachable and very much working with my patients instead of just telling them what I think we need to do. Feel free to ask me any questions, and I'm here to kind of meet you where you're at and try to develop a plan that's satisfactory for both of us. I really view medicine and working with my patients as very much a team approach. I love surgery, I love doing surgery, but a lot of times we kind of determine, me and the patient, that surgery might not be the best option for them. Sometimes it's a stepwise fashion where we'll try a bunch of other interventions and then it might end in surgery, but I like to kind of work with my patients, see where they're at. Some people come in and are ready for surgery right away, and some people want to try all the other options, and I'm very open to exploring all the other options and working with my patient to determine the best plan of care for them. One of the things I was very surprised about is just how kind of up-to-date and cutting edge it is here for a little kind of rural hospital. One of the big things that drew me here was the fact that we have the robot here. And the fact that a small hospital like this is able to offer robotic surgery to patients, I think is amazing. So I've been just continually impressed on how supportive, how caring everybody is here, and really how up-to-date they are on everything. I do like kind of being able to see people in the office and, they're relatively healthy, we're planning surgeries, and then I have some inpatients who came in more acute and need me to intervene on different levels in that. And then being able to go and actually physically do the procedure. So a good day for me would be kind of a mix of all of it, rounding on my patients in the hospital, seeing some patients in the office, and then being able to do either the colonoscopies, EGDs, or surgical procedures in the operating room. I really love especially seeing patients in the post-operative kind of recovery period. When they had a problem, they were having pain, they weren't able to eat, kind of a variety of things, and then seeing them on the other side of that and seeing them get better, I think, is what really gives me kind of joy and pride in what I do.